Good morning, folks. Ron Ray here with Turning 65 Solutions. For today's video, we're going to ask a question we get multiple times per day, and that question is, how are prescription drugs covered with Medicare? And that answer sounds like it should be pretty simple, but it's not always the case. So you have to remember there's two sides to Medicare. There's original Medicare, where you keep original Medicare A and B, and then you add in a supplement, and then separately you add in a prescription drug plan, Medicare prescription drug plan, also known as Part D. Or there is the Medicare Advantage side, that's also called Medicare Part C. That is where you tell Medicare that you don't want Medicare to take care of you. You want them to contract you out to a private insurance company that you choose, and they combine all of your services into one plan. So you have your hospital coverage, your medical coverage, and your prescription drug coverage all in one plan. I'm going to talk about that in a moment. The first thing I want to cover is original Medicare. Okay, so with original Medicare, you remember you have original Medicare A that covers your hospital expenses, original Medicare B that covers all your doctor's office visits and outpatient services, and then you have a supplement like a Plan N or a Plan G that covers all the out-of-pocket costs associated with Part A and Part B. A maximum of 80% is what they pay for those, so that leaves you with at least 20% left behind to pay. Okay, your supplement G or N or F will pay most or all of those out-of-pocket expenses. One thing that those items don't cover are prescription drugs. Prescription drugs are covered under a separate program called Medicare Part D. So I want to take you to that. First of all, I want to point out this article we have on our website, www.t65s.com. Very good article that covers in much more detail than I'm going to go into in this video on how Medicare Part D works. I'll put a link to this video in the description down below so you can go straight to it and check that out. But I want to go right here. So hold on. Okay, so here we have an example of what a Medicare prescription drug plan would look like. First of all, you pay a small monthly premium. I say it may be small, it may not be small, but they range from just under $10 a month to close to $200 a month. And there's, in most areas, there's 20 to 30 plans available. We're in the San Antonio, Texas area, and we've got over 20 plans available. And that's not the case everywhere. It all varies by your location. So be sure and check with a good local agent where you're at, or give us a call and we can look it up by your zip code. But you pay a monthly premium. We don't know what that is until you do one very simple little thing. You bring us your list of prescriptions, however long or short that may be, and we plug those into the Medicare website. You can see the website down below, medicare.gov. And it's anonymous. You don't have to put your name in, but you put your list of prescriptions in, and what that website does is it takes all of those plans that are available and it sorts them based on your total out-of-pocket cost for the whole year. Now that includes your monthly premiums for the plan, plus any deductibles that may be required, plus your co-pays when you go to the pharmacy. It adds all of that up and tells us what's your actual bottom line out of your pocket for the whole year. And then, because it also tells you what pharmacies work best, you just pick your pharmacy and then you pick the cheapest plan. Now, here's the catch to that. You have to do that every single year because these plans change every year. And you can only change plans once a year during the annual enrollment period from October 15th to December 7th, and your new plan will start on January 1st. Picking the right plan is the tricky part. That's what we help people do. We help you pick the right plan. Now, you can certainly go to medicare.gov and do this yourself, but we're happy to help you with it. It doesn't cost you a penny. It doesn't really take us very much time if you give us your list, and we can get it done for you. So picking the right plan is the tricky part. Once you've got your plan, it works very closely to what you've had in the past. So you pay a monthly premium. Again, we don't know what that is until we do that evaluation. After that, there is an annual deductible. So once a year, you'll have a deductible somewhere between zero and $485. Okay. Now, not all the plans have a deductible, but most of them do, and most of them go up to the maximum allowed by Medicare, which in 2022 is $485. After you've met the deductible, then you'll just pay a copay at the pharmacy. So your generic drugs will be very inexpensive. Now, I want to point out that these are just examples. These are not the real numbers, but they'll give you a good idea. Your generic drugs will be very inexpensive. In fact, a lot of them will be free. There'll be zero copay for those generic drugs. But as you go up those tiers into the brand names and the specialty drugs, well, the copay, that's the amount you pay out of pocket at the pharmacy, that goes up. And they can get pretty high. In fact, some of those brand name drugs can be downright expensive. So it's very important that you pick the right plan that's going to fit into your budget as best as we can fit it in there for your particular drugs. Not every plan has the same copays. Not every plan has the same formulary. So it's very important that we do a good evaluation. Don't just sign up for the first plan that shows up in your mailbox that says zero deductible, because if they're not getting it on the deductible, guess where they're getting it? They're getting it at the pharmacy. So be very careful with that. Now remember, everything about these plans can change. The copays, the premiums, the deductibles, the formularies, your prescriptions can change. The doctor can put you on something different. And again, you can only change plans once a year during that annual enrollment period from October 15th to December 7th. Now that's Medicare prescription drug plans under original Medicare. That's called a standalone prescription drug plan. We also refer to it as a PDP. That's under original Medicare. Remember, you have original Medicare A and B, and then a supplement, and then separately a prescription drug plan. Okay, now we're going to talk about how prescription drug plans work under Medicare Advantage, Medicare Part C. Okay, remember, Medicare Advantage, you tell Medicare that you don't want them to take care of you this year. And so for that calendar year, they've contracted you out to this insurance company. Now, for most of you, you're going to continue to pay the $170.10 a month that you're paying to Medicare. But now Medicare sends that money over to this private insurance company that you choose, and they combine your coverage into one plan. So you have your hospital, your medical, and your prescription coverage all in one plan. Now, I want to have one caution here. Not all Part C plans, not all Medicare Advantage plans include drug coverage. And it's very, very important that you know that and that you watch out for it. Because if you have a plan that is not a medical savings account, an MSA, or a private fee-for-service, PFFS, if you have a Medicare Advantage plan without prescription drug coverage and it's not one of those two type plans, an MSA or a PFFS, you cannot get a standalone prescription drug plan to go along with it. So if it's a PPO or an HMO without drug coverage, you cannot get a standalone prescription drug plan, and you're not going to have drug coverage if you don't have it through another source like the VA or TRICARE. Now, if you have a Medicare prescription drug, if you have a Medicare Advantage plan, such as a MSA, a medical savings account plan, or a private fee-for-service PFFS plan, then you can get a standalone prescription drug plan. Okay, those are two kind of not odd, but unusual situations. An HMO or PPO without drug coverage, and a MSA or PFFS without drug coverage. HMO, PPO, you cannot get a standalone. MSA, PFFS, you can get a standalone. That covers, let's just say, 10% of everybody. The 90% of everybody else on Medicare Advantage have prescription drug coverage included. That includes your HMOs and your PPOs with prescription drug coverage. Okay, so that's called an MAPD. MAPD. That stands for Medicare Advantage prescription drug. Okay, Medicare Advantage with prescription drug. MAPD. Now, that was a long little introduction to now tell you it works if you have an MAPD. The prescription portion of the plan works pretty much the same as if you had a standalone prescription drug plan. Except that you usually don't pay a premium. It's included in the premium or zero premium that you may pay for your Medicare Advantage plan. But it will still have a deductible. The deductibles are usually lower than a standalone plan. And it will still have copays, although most of your generics, again, will still be free or zero copay at their preferred pharmacies. That's another thing, is these do have network pharmacies, preferred pharmacies that they prefer that you go to. In fact, some of them are owned by large pharmacies. So be careful, do your research, give us a call if you have any questions about this at all. We do this every day, and we love to help folks like you navigate the Medicare landscape. So give us a call. The number is 830-217-6711. Also, look us up on the web. Again, we've got a great website that goes over this information, and we like to put this information out there. This article has great detailed information. This is just a quick video for YouTube. Can't spend a whole lot of time here, but you can go to the article, or you can give us a call anytime. It's www.t65s.com. I'll put a link to this video in the video description down below for the webpage. If you enjoyed the information in this video, if you found it helpful, please give us a thumbs up down below. That helps YouTube get this video out to other people who are seeking the same information that you were today. And don't forget to subscribe to the channel so that you can be notified when we upload a new helpful video. So we hope you enjoyed it. And until the next time, we hope you have a great day. Thanks, folks. Bye.